Stroke is a serious medical condition that occurs when blood flow to the brain is interrupted. This can cause brain cells to die, leading to a range of symptoms and disabilities. Stroke is a leading cause of death and disability worldwide, and it can affect people of all ages, including men. Early recognition and treatment of stroke are crucial to minimizing brain damage and improving recovery outcomes. This is why it's important to be aware of the early signs of stroke in men and to act quickly if you suspect someone is having a stroke. In this video, we will discuss the early signs of stroke in men, as well as the importance of recognizing and acting quickly. We will also provide information on how to get help for someone who is having a stroke. Early signs of stroke in men. The early signs of stroke in men are similar to the early signs of stroke in women. However, there are some key differences to be aware of. Some of the most common early signs of stroke in men include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. This is often described as a tingling or numbing sensation, sudden confusion, trouble speaking, or difficulty understanding speech. This can include slurred speech, difficulty finding the right words, or difficulty understanding what others are saying, sudden trouble seeing in one or both eyes. This can include blurred vision, double vision, or tunnel vision, sudden trouble walking, dizziness, loss of balance, or lack of coordination. This can include stumbling, falling, or difficulty turning. Sudden severe headache with no known cause. This is often described as a thunderclap headache. Other less common early signs of stroke in men include nausea and vomiting, sudden seizures, loss of consciousness. It is important to note that not all men will experience all of these early signs of stroke. Some men may only experience a few of these signs, while others may experience none at all. Recognizing and acting quickly. If you suspect that a man is having a stroke, it is important to act quickly. The sooner a stroke is treated, the better the chances of recovery. Call your local emergency number immediately. Do not try to drive the person to the hospital yourself. While waiting for emergency help to arrive, you can help the person by keeping them calm and comfortable, making sure they are lying down on their back with their heads slightly elevated. Loosen any tight clothing around their neck or chest. Do not give them anything to eat or drink. Monitor their breathing and pulse. Getting help for someone having a stroke. When you call, the dispatcher will ask you some questions about the person's condition. Be prepared to answer the following questions. What is the person's age and gender? What are the person's symptoms? When did the symptoms start? Is the person conscious or unconscious? Is the person breathing? The dispatcher will then send an ambulance to your location. The ambulance crew will assess the person's condition and begin treatment immediately. Prevention of stroke. There are a number of things that men can do to reduce their risk of stroke. These include controlling blood pressure. High blood pressure is a major risk factor for stroke. Controlling cholesterol levels. High cholesterol can also increase your risk of stroke. Exercising regularly. Regular exercise can help to lower your blood pressure and cholesterol levels. Eating a healthy diet. A healthy diet can help to maintain a healthy weight and lower your risk of heart disease and stroke. Not smoking. Smoking is a major risk factor for stroke. Limiting alcohol consumption. Excessive alcohol consumption can also increase your risk of stroke. Conclusively, early recognition and treatment of stroke are crucial to minimizing brain damage and improving recovery outcomes. If you suspect that a man is having a stroke, it is important to act quickly and call your local emergency number immediately. By being aware of the early signs of stroke in men and taking steps to prevent stroke, you can help to save lives.